Okay, so we hit the majority of the tips and tricks that we can try out in the field to help facilitate really difficult intubations. There's just one more little trick that I kind of want to show you. With the bougie in our employ, it's really less important, but I just put this out there just in case we're ever out of bougies or it doesn't happen. But this is an old school trick, okay? We're taught by our medical director, Doc Giannis, and it's actually worked very, very well in the field, and it's going to take very little time to explain because you've already know the concept of how the bougie works. Is you're going to take your tube and make a really drastic hockey stick on it. Okay, now again, put the blade in, you'll see the epiglottis, place this to where the point is going upwards onto the epiglottis. The trick is communication, like all things, okay? So up top, what the partner's gonna do is slowly retract the stylet, and look what happens at the tip. See how it angles straight up like a scorpion tail? Although if I have something here, as he pulls, it's going to advance it forward, maintaining anterior pressure, versus going straight down. It's a fantastic technique. We've used it on a lot of real patients in the past. It works pretty much every bit of the time. I'm not bold enough to say 100% of the time, but I truly can't remember a time it didn't work. The only time you'll have a problem with this issue is if you if you have your partner and you say, okay, slowly pull the stylet out, and they yank it. Okay, of course, that's gonna start everything from scratch. So what I would recommend, especially if it's somebody who's never seen this before and you want to use this technique, to have your partner grab the stylet and just pull it up about 2 or 3 inches and stop. And now from here, he holds and doesn't move, and you go ahead and drive the tube forward, which, as you see, will end up doing something like this right into the cords. Okay? That's about all we have for right now. Please send us any questions that you guys have for any of these techniques. I encourage you to practice these, because if you're going to have them actually work for you, you really have to employ the muscle memory. It's one thing to see these tricks and know these tricks, but unless you're used to putting your hands on them and practicing them, they won't come naturally to you when it's time to employ them, and you're going to remember them after the fact when you bring the patient with a king tube when you could have actually intubated them appropriately.